Did you know that various factors can affect your fertility, like your age, medical conditions, and even treatments such as chemotherapy? Many celebrities such as Diana Hayden, Sushmita Sen, Neha Dupia, Priyanka Chopra, Paris Hilton, Celine Dion, etc. chose to freeze their eggs when they were younger, and many of them used those eggs to get a biological child in the future. So whether you are a man or a woman, single or in a relationship, fertility preservation will help you protect your chances of having a biological child in the future. Hi, I'm Dr. Jwal Banker, and today we'll be discussing on fertility preservation, a topic which could make all the difference for those who dream of having a family one day. Fertility preservation can provide hope for people who face a risk of infertility in the future due to either medical reasons or just wish to delay pregnancy or parenthood due to personal or professional reasons. Today we'll be covering all aspects related to this topic, so let's get started. So what is fertility preservation? Fertility preservation is the process of saving or freezing eggs, sperms or embryos for use in the future. This is done in order to have a chance of a biological child in the future. So who needs fertility preservation? Fertility preservation is recommended for two primary reasons, either medical or social. There are certain medical conditions in which the person or the couple faces a risk of infertility. These can be cancer and its treatment like chemotherapy, which can affect the reproductive organs, certain genetic conditions such as Turner syndrome, Fragile X syndrome, etc. Certain autoimmune conditions such as lupus, they also face a risk of infertility in the future. Certain gynecological and progressive conditions like endometriosis and even a history of ovarian surgery in the past, these people have a risk of an early diminished ovarian reserve, and fertility preservation can help these women. The American Society of Reproductive Medicine has also included endometriosis in the list of conditions who may benefit from fertility preservation. If you have a family history of early menopause, like your mother had an early menopause, then even you face a risk of a premature fall in the ovarian reserve and can benefit from this procedure. Now, besides medical reasons, there are certain social reasons for which fertility preservation is recommended. These can be a late wish for marriage, career aspirations. Many women are focusing more on their career and want to delay marriage, pregnancy or parenthood. So fertility preservation can help them take more control over their reproductive life. Advancing age, if you are nearing the age of 34 or 35 years, then this is definitely recommended for you. Relationship status. Some males or females might not have found the right partner, and this can also help you protect your fertility. There are also certain lifestyle choices like traveling or education, which prevents you from planning a pregnancy in the near future. So for all these medical and social conditions, fertility preservation can help you protect your fertility. So what is the right age? The ideal age for fertility preservation depends on the person's overall health and medical conditions. However, it is recommended to go for fertility preservation at an early age, that is before the age of 34 years, as you age, the quantity and the quality of eggs keep on decreasing. That means the younger the age, the better the number and the quality of the eggs. For those people who opt for fertility preservation for medical reasons such as cancer, they can get it done and should get it done as soon as possible if time permits. It is important to remember that because of our genetic makeup or our ethnicity, the Indian ovaries age 5 to 6 years faster than the Western world. 40 years in the Western world is equal to a 34 or 35-year-old woman in the Indian scenario. Hence, the younger the age, the better the results. So what is the success rate? This primarily depends on three conditions: the age at the time of freezing, the reason for freezing, and the number of eggs frozen. A large study in Spain, which is one of the highest series till date, showed that the success rate of fertility preservation or the live birth rate with the used eggs with fertility preservation was as high as 94%. But that is for women who froze their eggs electively before the age of 34 years and had 20 or more eggs frozen. The same younger women, if they had around 10 eggs frozen, the success rate fell to around 40 to 45%. For elderly women, that is above the age of 35 years, if they had around 8 eggs frozen, the success rate was around 15 to 20%. So this suggests that the younger the age, the higher the chances of success. So in general, a range of around 12 to 20 eggs in younger women is considered to be a good range. And if the age is more, or if you have less eggs in the first cycle, the woman might need to undergo multiple cycles in order to collect a good number of eggs for future use. So what are the methods available for women, men or couples? For single women, the most common method used is egg freezing or oocyte cryopreservation. This process involves stimulating the ovaries with gonadotropin injections to produce multiple eggs, then extracting these eggs from the ovaries and freezing the mature eggs and storing them for future use. For men, the most common method is sperm freezing. This includes collecting the semen in a sterile container and freezing the sample. Or if the male is not able to produce sperms or ejaculate, then we can extract sperms directly from the testes through procedures such as PESA or TESA and freeze the sperms obtained from the tissue. For couples, a good method used is called embryo cryopreservation, in which ovaries are stimulated, eggs are collected, then these collected eggs are fertilized using husband sperms, and good grade day 5 blastocyst embryos are formed, and these embryos are then frozen and stored. Whenever the male, female or the couple wants to get pregnant, then these eggs or sperms are thawed and fertilized using partners' gametes, and embryos are formed. If the couple already has had embryos frozen, then these embryos are thawed. This embryo formed or thawed is then transferred back to the uterus, which can give a pregnancy. So what are the limitations of this process? Though fertility preservation is a very promising approach, it does have its limitations. The primary success depends on the age at the time of freezing, the method used for freezing, the reason for freezing, and the quality of the eggs, sperms or embryos frozen. Fertility preservation does not guarantee a pregnancy in the future. It only protects your chances of having a future pregnancy. So how long can these eggs, sperms or embryos be frozen? Now each country has its own guidelines on the duration of fertility preservation. According to the latest Indian laws, the egg and sperm freezing for this purpose of fertility preservation is allowed till as long as the man or the woman wants to preserve them. If the couple has had embryos frozen, then these embryos can be frozen for 10 years. But each country has its own laws and guidelines on this topic. So in conclusion, fertility preservation can provide hope for those women who face a risk of infertility in the future for medical reasons or wish to delay pregnancy and parenthood for social or professional reasons. Your biological clock is ticking and it is time you start considering this option of fertility preservation. Let me know if you have any doubts in the comments, and thank you for watching.